He is a famous orthopedic physician in Calcutta, and he deals with mainly injury-related problems. And sports persons who often get injured, they are also treated by him, some of the very famous sports persons in Calcutta. And he is also associated with our university as a faculty in the Department of Sports Science and Yoga. In fact, he was the person who initiated the whole department in the beginning. So the yoga and sports science MSc and MA programs and PhD programs are running successfully. He has been associated with the department since the beginning. And we requested him to talk on pain management and yoga, and he's kindly agreed. And since he is a professional doctor practicing for a long time, for several decades, also interested in yoga, so we can hope to have a very scientific explanation of how pain can be managed through yoga. Hope you'll enjoy the talk. At the end of the talk, you'll be able to take a couple of questions. Now we request Dr. Dasgupta to make his presentation. Dr. Dasgupta.
Today I will talk regarding, as said, pain management in yogic way or in this pandemic situation. So I am associated with mission for the last 10 years. So I'm also influenced with the things what is going on here in our university and in the Belur. So to start with, I should follow the norms. I start with the Bhakti Shloka. As like this, we will pray for it and then we will start our topic.
Sahana bhavatu sahano bhunaktu sahaviryam karvavahai tejasvi nabadhitamastu ma vidvishavahai. Om Shanti Shanti Shanti.
So let us start with our topics, that is pain management and yoga. First of all, I must say the pain is acute and chronic. As you know, if any pain lasts for 3 to 6 months, is we call the chronic, and which is immediately after injury or any problem or disease, we call acute. So we used to accustomed with the chronic one. In acute, people used to manage themselves with cryotherapy, medicine, and etc. So we used to face the person who was suffering from chronic pain. So we know this pain, nociceptive, that is, one is somatic, another is visceral. It's very simple. Somatic means our bones, joint, muscle, connective tissue, that what we can touch ourselves, our body, this is called somatic. Or in other term, in physiological term, we can tell it musculoskeletal pain is one, and another is visceral, which is very important and which is very difficult to tackle. Is the organ like heart, liver, pancreas, gut, spleen, so many organs inside. This is called the visceral pain. And another is neuropathic pain. This is the nociceptive pain, another is neuropathic pain. In neuropathic pain, we have got three divisions. One is deafferentation, another is sympathetic pain, and another is peripheral. They go through the nerve, along with the nerve path, and they follow the path. Someone it finished at the spinal cord level, and some pain sensation it goes straight to the central nervous system in the brain and all these things. And if you see the nociceptive pain, if we touch this sort of nails or the tree, then we will feel pain over our finger. Then what happened? You see, this is the transduction, which is, you can see this is the skin, and these are the internal structure inside, and they are the vessel, blood vessel, and there is also the nerve fibers, which also touches the skin. So whenever we touch the skin, either it is by prick, acute, or it is burning, or it is bland, everything, it will be sensitized by the nerve fibers which is present in the skin. And then this skin sensation will go to the spinal cord. This is the one of the neuron, you see, this is the nerve cell. This is the nerve cell in our body, where we can see that each and every nerve is like this unit, one cell. So here we can see the cell nucleus, cell body, you can see, then dendrites with the afferents, and then the myelin sheath, action sheath, they goes inside the main area, either spinal cord or through spinal cord, it can go to brain. And if it is from the cranial nerves, that is the 10 cranial nerves, if they touches in that way, from the signal, it will come from dendrites. Dendrites will feel the signal, and this will pass to the central nucleus body, where there will be some changes, and there will be, they will send this signal to the action, and the action is myelin fiber, and it will go to the the main either spinal cord or brain. Next, the conduction, how these impulses goes. This is the main physics. They also follow this thing, conduction, traction, all these things. Let's see. Then these are the things, the transmission of the nerve impulse. How you can see how it can go by. It is a transformation of the nerve impulse. It goes. You can see. There is synapses in between the nerve cell, and this is the action and dendrites. They join together and pass off the impulse. Next, you can see this how it goes. What I am telling, that if there is a nervous sensation, it will go through spinal cord. It will enter into the spinal cord by afferent vessels. Then from afferent, there will be meaning, and then this signal will send through the brain to react the motor function, what to do, and all these things. Next, pain transmission is this perception, then modulations, then transmission, then transduction. This is the way. So you can see these are the, if you think this is the proto diagram of a hand, how this transduction, transmission, and modulation and perception, these are the three. You can see gradually it starts from hand and goes to the brain as a perception, to perceive. As because this is simple, whenever we use some medicine for the pain, you take this medicine, so this perception, the drug used to work on the perception on the brain. It will suppress your perception. You can't mean, but pain will be there. If you're touching, it starts on this thing, but pain perception will be not there. For that reason, the analgesics like paracetamol, which is very used today, it is a dictum. You should not use paracetamol if the temperature goes beyond 101 or 2. Then they say the cause of this temperature will be inside, but the tablet or what the medicine we will use, it will suppress the sensation, or you will suppress the every activity to the brain. But the main cause is not handled with. So why we will use this medicine? This is also very important. This is the process we can go. So you heard that this is those who are suffering from hyperpyrexia. Pyrexia means temperature or fever. So if it is hyperpyrexia, this by definition, pyrexia and hyperpyrexia differentiate that if person is suffering from 103 and above, then we will call it is a hyperpyrexia. So whenever there will be a hyperpyrexia, then it is the dictum that you should not give any medicine for that. Straight away, you take a bath, a shower, straight away, and then come in the bed with the air and all these things. Immediately, your temperature will pass off. Still, we don't know why it's the cause of this temperature. We have to search it and we'll have to give that basic medicine, not the temperature relaying tablet. This is what we don't never follow in that way. We sometimes, afraid of that because if we take some bath in that time, there may be cough and cold, there may be pneumonia or all these things. But scientifically, it is the way you should suppress your temperature by taking a bath. That means you will have to perceptive area of the brain who will have to use that thing externally. Next, you can see there is two things, that is endorphin and opioid. So this is endorphin and some receptors organ also that there. So here I like to say something. Just remember these points regarding pain. We have so many ideas regarding pain. Like in our allopathy, this pain is passing through these nerve efferent, then spinal cord, then to the higher side and all. This is one theory of allopathy. That another theory the Chinese people used to believe, and they run in that way. That is, you have heard the name of acupuncture. And that is their system. They call this system as Qinglo system in their language. They say all the organ has their surface representation over the body. Like we have the kidney, we have the gallbladder, or the liver. Their surface representation will be somewhere they describe in their books. And their theory is that our body is run by two systems, that is yin and yang. Yin means if the visceral activity becomes more hyper, then we can feel some problem with our organ, and that will be represented in the surface. And yang is a negative charge, it will represent in our surface. So whenever there will be problem with anything, like visceral, also the musculoskeletal, there is a point also in the musculoskeletal system where you can go. Like the one very common disease, you all know what we call frozen shoulder. But in allopathic term, it is called the adhesive capsulitis of the shoulder. So there are so many treatment, especially the exercise is the main treatment. Then we can put some steroid, local injection to manipulate all these things. These are not 100% sure the result. But if we apply the Chinese policy of yin and yang theory over the surface with the needle, then I'm telling you, it's my experience, within 7 days, the pain will cool down. at least 80% will be off. That's what we have seen in our education life. So I don't know whether this, what we are telling, the peripheral signal from the nerve is goes to the central and all these things. Now, the Chinese people use that thing, this Chinglo system, and put their needle over there in the surface, and they really give you the better result. And that result, I am telling you, as soon as they will apply this pin in the particular, in a correct position, then they can feel there is no pain. I am telling you another thing. There was a very challenging for the allopathic person, what we called the Barger disease. So when we were students, then it was very difficult for us to treat the Barger patient. But Barger, in pathological way, we can call it end arteritis obliterans. Means end artery, where our artery ends in the periphery, say in the tip of the finger, in the tip of the toes. Then if there is end artery arteritis, then there will be ulcer over there, and that ulcer will increase. It will start from the toe, then it will gradually go up in the foot, then in the ankle, then in the leg, in that way. So what was our treatment during our time, student time? You go for amputation of that thing because there is no supply, so it can't live. So you'll have to cut it down, and this is very, very painful disease. And especially people can't, sleep in the night. The pain becomes very, very high intensity at night. So we used to see each and every patient used to be addicted with pethidine or opioid or like this thing to treat. There was no treatment. Only treatment was I look to amputate the thing and make it cure. And then there was, it is supposed to be tackled by the sympathetic system of our body, nerve system. So there was operation to cut the sympathetic channel so that there will be no pain sensation. If that can go up to 3, 4, 5 years, then once again there may be pain, there may be ulcer. Then you will have to take off the suprarenal gland, which is seated above the kidney. These are very cumbersome. Then ultimately people used to go for the pituitary removal in the brain. But nowadays, in our book, textbook, it has been written that what is the treatment for end arteries obliterans or Burgess? Acupuncture. Simple way, acupuncture. Go for acupuncture. And it is 100% correct. We have seen in our house of days, when we were training, to doing this acupuncture and all these things. Still today, if anybody used to come to me for a visit for the disease and all these things, I used to send the center, you go for acupuncture and you will be all right from that. So there are some theories, regarding pain. I am telling another thing. Still, we don't know the pathway of the pain. Chinese are telling in this way, and they are getting results. We are, as a allopathic, we are saying that this, physiology of pain or everything inside. And each and every time, this our human body physiological changes is changing to our ideas. It may be stand still, we don't know about the human body still. So people used to come, that is a very simple example I can give you. You have heard the name of peptic ulcer, duodenal ulcer. That was very challenging in our training period or student life. That every time, in the emergency, in the medical and surgery department, at least 10 to 15 cases used to attend every day from morning to night. And we used to tackle all these things. Somebody used to come with hematomesis, means blood vomiting. Somebody used to come with leaking, or this is what is called peptic perforation. And we have to deal with whole night with all these things. The medicine people used to do that, the surgery people used to do that. So that was our system, and you also know that our treatment was, and our one teacher used to say that treatment is that you purchase a cow and purchase a wristwatch, and you have some antacid with your hand and go on treatment with this thing. Means you have to see the watch, 2 hours you have to take the milk, and whenever you feel burning sensation, you put the antacid, and that was the treatment. You'll have to wait for the, you have to avoid the spicy food so that there will be no hypersecretion, there will be no ulcer formation. But funny thing, in the year 1971, one physiologist from Australia, he used to work in that laboratory where they used to deal with the peptic ulcer and this thing. In peptic ulcer, what was our diagnostic tool? So you go for titrating the gastric juice. You analyze the gastric juice and see the hyperactivity of the acidic or alkaline or neutral. We'll have to see. So the scientist used to do all this thing, and he was very curious. Yeah, what's the problem? Somebody is, we are telling that somebody is, is normal. There is no hyperacidity, but still he has got the ulcer. Somebody has high acid secretion, but no ulcer. And then one day, he took one thing, he took the sample from a person, centrifuged it, and he was personally all right. Then he swallowed it of himself, and he found that after 4 weeks, he was feeling pain over the stomach, and the symptoms comes like the peptic ulcer symptoms. Then he go for, this investigation and all this thing, and he found that he has also the peptic ulcer, and the cause was something else. It is a remnant. Then with the analysis, it was discovered this ulcer is due to some bacteria, Helicobacter pylori, which we call, and that was the invention, and he got the Nobel Prize also. And now if anybody is suffering from peptic ulcer or duodenal ulcer, there is a package of medicine for 3 weeks. After 3, if you go for endoscopy and that thing, before giving the medicine, then after taking the medicine for 3 weeks, you once again see it, you will see the healed ulcer over there. So physiologically, I would say we are still aware or not aware with the true fact. You don't know. Then somebody will tell, about 3 years back, the physiologists invented, or they declared, there is an organ which covers the thoracic organ with a with a cloth-like structure. This is another, this organ of our body. So now they are working with that. What is their role? This thing. And recently you heard the patient, a player of Denmark, who while playing, he fell down due to cardiac arrest. And due to cardiac arrest, he fell down, and they resuscitated, giving him the CPR with the defibrillator outside the label, and he got the sensation 12 minutes after, and he was sent to the Copenhagen hospital, which is very sophisticated with the sports medicine labs and all these things. They investigated everything, and they found there is a problem with their heart. So they put an implant which is called defibrillator in the heart. This is the pericardium, which we call the pericardium, that is the covering of heart. They put a small defibrillator inside there. So this defibrillator will work when suddenly there will be cardiac arrest, no activity. So this thing is tuned like in that way. Whenever there will be your arrest, it will start working. And 2 days ago, a player of Finland, he who has this implant, cardiac implant, defibrillator completely inside the heart, and he is playing with that thing with 10 years, and he is the national player of Finland, and he used to play the Euro League and all these things. These are the things, if everything is changing, you got to do everything. Now, another thing I am telling you, our scientists in America, they invented one kidney, artificial kidney, though it is very costly first time. And you will be here to know he is from this side. He is from Dhaka. He's some Dr. Roy and the thing. He's working on this, and they are telling that this kidney will work like anything. It will not betray any time. Even our normal kidney can betray. This kidney artificially made will not betray. So we will have to think what is there in the pathology, what we are doing, what is reality on all the things. Like another example I am telling you, what we as a allopathy, we used to call you take your food and all these things time to time. You should not empty your stomach and this. But our old version is that we should take the meal twice a day. Why? Scientific explanation is that it used to take 6 hours to digest our food, and then another 6 hours for detoxicated the material. Whenever we digest and all these things, we use our thing, and then there is some toxic effect or toxic product we have in our stomach that will be passed up, and it will take about 6 hours more. So you should take the food 12 hours. And, what to my mind, I know the people who are the what we call sadhus and all these things. They used to take very simple food, and what we used to bother about the nutrition. You have to take this one, you have to take this protein, you have to take the fat, you have to all this. For them is nothing. You can adapt yourself with that theory. Like they have also used one thing, you should not use their dairy product. Dairy product, you can take milk as a cow's milk or buffalo, whatever you like, but don't go for dairy products. Number one, they are toxic for each and everyone. And I'm afraid our doctor used to tell you should take double tone milk and all these things, it will cure your heart. These are not true to me, because you will have to go for that process, that chemical process, that is very harmful to our body. Rather, you don't take milk, no problem, but you should not go for any toxic thing. Another thing you also know, we are also using what is called organic product, organic manure. This is also the time you should go for it. No artificiality, it should be the original. And if you see our Quran or everything, our epics, all these things, they used to take the purest thing, and what each and every individual, it is different. He can choose it, he can do it, and everybody is very fine with them. Here, I like to tell one thing, but in the year 2009, probably, so 2009, it was a privilege for me to see Mataji. You probably know he died on 2009, probably at Dakshineshwar, and her name probably, if you follow all these things, she is Sharada Mount in Ramakrishna Mission, Sharada Mission's president, Prabrajika Shraddha Pranaya Mataji. In the last few hours, I have the privilege to see her in a hospital, which I remember, the Belur hospital. And believe me, from that day, I believe there is something, either meditation or whatever. They are they used to do every time puja, bhajan, and all these things. So I was talking with her during that time. Her pulse rate was, believe me, his pulse rate was 140 up, and his respiration rate was 40 up. You can, all the physiologists know, if we have got the pulse rate in normal is 80, if anybody has this 140 or beyond, and the respiration rate is usually 20, Mataji's respiration rate was 40. And whoever, just think, a person who is on the dying stage with the respiratory distress and all these things, any person can talk in our theory during that time. And telling you very frankly, Mataji was talking with us in a very simple mood. And she was asking, how are you all? Now it is 12:30. You should go to your house. And she was, conversing with so many, normal things in a very simple way. If a person with a normal temperature or normal pulse rate or respiration rate, she was talking like that. So we were 2 or 3 friends were there, all the doctors. So that day, I used to realize there is something, whatever person can challenge about the meditation and all these things, that was the effect of meditation. And we'll have to go for such what way. And I'm really telling you, we have got the yoga students, and very soon we will go for observing all these things, how they run their body system in that way. Because I'm telling you, and this purpose, I got a project in Calcutta University along with Dr. Amit Bhattacharya. So the effect of high intensity sports on the hematological view and the oxidative stress of the cell. So we will soon launch it. They are going to permit it. They agreed, DST. So we'll start. And similarly, I was thinking these all are the things we can do in our yoga students. We can see it because the yogic system is 100% correct, and we will have to prove it. Yes, it is correct. We can see the physiological changes. We can do all these things with them. Only thing in yoga practice, we are still not able to say why it is, what it happened, what we should do. This is one thing, we'll have to give the answer, and the answer is there. We'll have to search for it. As because in this pandemic situation, you just see about 16 months to 17 months, we are telling as a lockdown should not come out of the body, and everybody is there, including the sports person. And if you like to do any exercise or activity, you'll have to go to the, this Maidan, or you in the trekking field, or in outside. Anyway, it is the outside, and this is restriction. You can go outside. So what is possible? They should do the yoga, yogic practice, the asana for them to keep themselves fit. This is this COVID situation. I learned this thing. That's why in our cricket fraternity, we started doing gym and yogic exercise. So it is very important when we call, you should be stayed inside, but you should go for exercise and all these things. That yoga is the answer. So we must give the yogic asana practice to each and everyone. We should make it popularized so that they can do or they can be fit for their abilities and all. That is also. And in you can see the yoga for pain relief. This is for what? Arthritis, the joint pain, then fibromyalgia, this is muscle pain, migraine, headache, you all know, and then chronic fatigue syndrome. And what I am telling, these are the postures. This you all know. The yogic students and so many person in the physiology can know how the yoga can be done. It is nothing. We have just copied in our exercise theory. This was original from our side, from Indian way. Now everybody is asking, you probably know in America, they have taken about 500 acres of land to make a yoga center or the college, whatever you call. They are training for this thing. They proved themselves it is possible. So you can see the what are the this is the version what in Sanskrit or in language what is called. I have translated it in the way how we can do it. Make one leg like this way, then butterflies posture, then whatever we know the frog posture next. So these are the exercise. There is the knee pain. For knee pain, what are the exercises? These are the yogic exercises, and you just mix it up with our allopathic physiotherapy on physical training. This is just this way. That is the physiotherapy and rehab. We have to go for this thing also. This is what is ancient, is ours, and we just forget everything with the using all this gym protocols, everything. But if you can do this thing from very beginning, we no need of this gym and all these things using the this material. No, this costly. We can do everything with this simple way, and it will affect you the same way. And another thing, I remember Atmapianandaji told that day that while doing asana and all these things, pranayam, anulom bilom, if you do sincerely all these things, then it will be possible for us to see it and meditate ourselves. This is the primary stage of this thing. We tell about it's very difficult to do the meditation and all these things. No, if we can do these exercises and very, very honestly and go for breathing exercise, then we can sit for the meditation. We can take time, 5 minutes or 2 minutes, whatever, but we can go for the meditation. And another thing, we can prove it that Orko was telling one day, we have got the MRI also, fMRI, which is called. You'll be very happy to know that in Calcutta, we have got all the fMRI. If somebody is doing meditation on all these things, then it is proved that while in meditation, there will be two waves from the frontal lobe comes out. One is called alpha, another is beta. And they, in turn, when there will be waves and all these things, they will stimulate the internal organs, which will secrete the hormones. And that hormones has got their own effect over the viscera with the musculoskeletal system everywhere. What are these hormones? One is endorphin and another is amide. With the endorphin, it will secrete, and you can see we have got a book, very good book written by Neil Madhav Das. If you know Bengali, we also know, you used to read his books when we were students, where he wrote that with exercise and this yoga system, what are the endocrine secretion will be there. He specifically wrote all these things. They have studied, but now these books are obsolete. Nobody go for it. But everything is written, how you can go, what should be the allergy, what should be the calorie of all these things. we can know all these things by reading all this process, what they are doing here. These are the exercises we used to give for the low back pain patient, or we used to give for the knee pain, you mean for the pelvis pain. We used to give, these are the advice, you go for it. And this is called physiotherapy. Then another therapy which is called, we use is electrotherapy. Electrotherapy is example, shortwave diathermy, then ultrasonic ray, so many, electrical and then electrical stimulus, everything is there. We can be, and we can meditate this our body in that way. But first of all, these are the exercise, these are the yogic exercise, which is very simple and which is our own method of treatment earlier, and we just forget all these things. I'm really very much um, happy with the attitude of Atmavivekananda ji. He is telling us, go for it, go for change, go for see all these things in scientific way, go for research for the yogic person. These are the real motivation for us. We should go for it. We should give, even we started the sports science also. They also should know what should be done. You see, here is, you can see the 10 minutes work, yoga. What we should do, if we'd like to do an exercise for the 10 minutes, you will go for it. You start it. Then you can go for another 20 minutes. You can increase it gradually. These are the asana. You will get a pleasure of doing all these things, because these asana, all these things will stimulate our reticuloendothelial system. You know what we used to call nowadays, that is our immunity powers fall down, our immunity. That's why the COVID is coming, COVID is giving us, we can't live, because our immunity is in problem. So if you do the exercise, especially the yogic exercise, it can stimulate the our limbic system or reticuloendothelial system, and that reticuloendothelial system will give us some of the medicine which will be coming as a hormone from inside. And what I was telling in the American people, they tell this endorphin, another is amide, and they call it is anandamide, as because this is from the Indian origin, anando, and this is the anandamides. Their research, they are doing all research with this thing, and with the fMRI they are getting all this, the waves and all. Because you know that the patient who is suffering from epilepsy or something like that, they have got aberrant stimulus or aberrant waves comes out from the brain, and that used to cause the stimulation, and there is involuntary movements or all these things. So we used to check it through medicine or something else. So this is also a system from where we can work in that particular field with the yoga and meditation. And in pain management, what we used to do, we first use the medicine, painkiller XYZ, so many things. And each and every painkiller, excepting the paracetamol, which is the basic, all are the medicine are very bad for health. They used to work in a path. In that path, kidney, liver, heart may be affected. So while using, because of pain, you are using medicine for a long time, that will make the problem in the heart, in the kidney, all these things. And we are getting nowadays so many renal failure person. There was no cause behind, there was no family history, but only thing that the person is suffering or suffering from pain, and they used to take the medicine which allays pain and all these things, and gradually they got their, this organ, the kidney failure. One of our famous teacher, famous anesthetist, he also died with that renal failure, because he used to take medicine for pain. He has got a very bad type of back pain. That's why he used to take, while doing job and all these things working, he used to take one so that there will be no pain. And gradually having that thing for 2 or 3 years, then ultimately he died of renal failure. They're very sad. We should not do, we should check it. So one medicine which is applicable is very simple, is our paracetamol. This is the main. And in Europe or America, they are using another thing, opioid, morphine. And nowadays they are telling this morphine is dangerous because it makes the habit and all these things. The generation is destroying themselves. So we'll have to think this morphine, beyond morphine, we should think something. So there is a medicine which we have in the name of Ultracet or the Tamazac, in which there will be paracetamol and some opioid derivatives. It's not direct opioid derivatives. This is perhaps safe. So these are the medicine we used to give. Then if needed, we can give the injection, parenteral. We can give the injection IV, everything. Then another treatment is in pain. What we use, that is the invasive treatment. Invasive treatment means if there is a pain, say somebody is suffering for trigeminal neuralgia, which is a very severe pain. It affects in the this face and all these things. So no medicine can help, and people become mad with this thing. So we have treated this patient in our institute, pain management institute in Shialda, that if we put some local medicine, local anesthetics, along with some steroid, what particular that nerve fiber who carries the pain sensation, then he will be all right within 5 minutes. And he can stay with that effect of medicine for 6 months. Then once again, it may be needed for that. So what we are doing with the cancer pain, some of the pain, cancer pain is very pathetic. So we used to give our patient, those who are, cancerous, suffering from cancerous pain. So we used to put this invasive medicine in the nerve fibers so that they can't feel the pain in their perceptive area. So that is also doing. This is the invasive, and there is in allopathy the non-invasive. And another treatment is physiotherapy, exercise. This is yogic, which I believe is 70 to 80% is okay for us. And we one person who has finished her PhD in arthritis, she was working with me, and she submitted this this thesis. So we used to treat them with initially with some pain, but we never go beyond Tamazac or Ultracet. Paracetamol we start with, and then we give them this exercise yogic way that Orko was telling one day. We will give a wider range of observation with all these things. I mean, very fine, you can do it. We have got I have got at least 300% with me, and with the exercise and this yogic procedure we advise, and counseling we advise. So you'll have to bear, because this sort of pain is for the person who is beyond 60 or 65 old age, and you have to make them understand that your everything is 65 years, including heart, your brain, your lung, your muscle, your joint. So you can get rid of all these things if you are doing exercise for the rest of the life in that way, so that the pain perception will be less. And I am telling you, we are getting about 90%, more than 90% result with that theory. One cause maybe they are not well off, they can't go for knee changing with spending 3 lakhs or 4 lakhs. So with all these things, we are getting the result. They all come. The economic group there was they were middle class, higher middle class, and middle class. They used to report us and say that is possible with that thing. So in that way, that we can manage the pain, the perception of pain with our exercise, especially the yoga procedure that you have seen. This exercise is the same. We have to do for honesty. We can go for 10 minutes, we can go for 20 minutes, we can go for 30 minutes. We should be honest about this. And whenever we do all these things, you can sit for the meditation immediately. You can take it, because sometimes whenever I feel, whenever I used to do the surgery, in surgery, we'll have to do very our brain used to work very acute way. You can't think about only the thing. And believe me, in that day, I used to get very relaxed from my relaxed muscle everywhere. Whenever I go for sleep, is special. There's no problem because there is meditation. And also, I am telling you, whenever I used to see the football game matches with the concentration, I get that effect also. So that is omnipotent. That thing we will get all these things if we do all such thing in our life. We can get rid of this thing. And also, if you think our socio-economic condition, we should adapt this thing. And I am telling you, if we do it, we'll get 95% result. I'm very sure about this. And in this pandemic situation also, what I if we are going for asana and all these things in this exercise, they can stimulate our reticular endothelial system, which secretes the immune power to our body. And if we do things, obviously it will be there, because in COVID situation, I'm telling you, there is no such medicine as such to tell about. These are the medicine, you use it, you'll get result. This is really very recently you have seen that the cocktail therapy, they used to use a cocktail about ranging about 60,000 and above, remdesivir, ivermectin, so many things, 5 or 6, you know. This may be change along with this thing. So you use it, they are getting result. I am telling you very frankly, they will let them do. They are calling that you will get the result. And for pandemic situation, this COVID situation, I am telling you, we are very much puzzled. What is called as, because if you use the plasma, what plasma used to give us, that is the antibody. If any person is suffering from COVID and he is cured, then his body will make some antibody to cope up with the situation. So if we give the plasma therapy, they started casual in Delhi, they started initially, it was started in Kerala. So they are criticizing, no, it will not work and all these things, all. But still today, plasma is the therapy, plasma is the treatment. Because in plasma, if we search this plasma, they have got the antibody. You have to see how much percentage of antibody within their body. Then you put that plasma to a person who is suffering from COVID, and if you apply it, they will be cured like anything. You'll have to go for, because there is, you also see ICMR are telling sometimes this one, and then AIMS Guleria is to tell something, who is to tell something. We don't know about this. The age of this disease is 16 months. So still we can't go for a conclusion what to do, what not to do. But a thing I am telling you, if you go for yogic exercises, if we go for the meditation, I'm 100% confident we will get rid of this notorious virus with that. And now here we can see, this is some of the picture. This is a normal one. You can see this, the blood pictures. Because our blood picture is normal, the physiology, they know this is the RBC and all, WBC is there. And these are the two, they are the slides with the COVID infected person. You can see the changes. You can see there is, oxidative stress over this cell membrane. And then you can see this is due to oxidative stress, the condition of cell membrane used to be like this. And what they do, this cell may burst. Then from the red blood cells, the hemoglobin will come out. And there will be rouleau formation. That's why we used to get the clot in the heart or in the lung because of that thing. So this thing used to, react with our normal blood. So we'll have to think that way to check it, how to do it. There is more research work we are waiting for. we'll have to give another angle. And I am telling you, this is my opinion, my view, that it is now in a very commercial way they are thinking. We should not go for the commercial way. No, we should think about that. One simple example I am telling you, when it outbreak in Maharashtra initially, very good number. So everyone was afraid of whether this Dharavi slam, what will be the result of them. And you all think make the distances and all these things. Here also there are those in Belgachia or some other slum area. There is no possibility, no way they can stay. There is simple area where they to stay 5%. And if there is community outbreak of the disease, then it's very difficult to save. But Dharavi, now this COVID victim is zero now in our part also. So that is, I am telling you, I am not telling this thing. To me, all this thing hits me that we still don't know about this disease, what to do. Otherwise, it would have been very difficult for us to do. So I think this is time is over now. So I used to follow our Atmapriyanandaji's advice with finishing with this slide. So we finished our lecture on this. I don't know whether you all enjoyed it or if you have any question to ask. I can.
Thank you, Dr. Dasgupta, for an excellent presentation, making it so interesting, so scientific, so acceptable, and blending it with the modern medicine and the yogic practice. Now, I don't know where is Mridmay Maharaj. He is supposed to moderate
Yes,
the question answer.
Maharaj, there are no questions today.
No questions at all.
No questions at all.
Oh, you have made it so clear that everybody. So everybody is so intensely happy, no pain at all.
Yeah.
So thank you so much for your presentation. Tomorrow there will be talk on Dr. Subrato Chattopadhyay. He is also a doctor. We are now having a series of presentations by medical doctors. Dr. Subrata Chattopadhyay is also a medical doctor, and he is a professor of medical physiology in the West Bengal Health University and a visiting professor of our university. He will talk about relation between mind and consciousness. He has also written a book on Mon o Chetana. So whether mind and consciousness are related, mind itself is hardcore behavioral scientists will say there is nothing called the mind. It is only a kind of epiphenomenon or a secretion of matter. And consciousness, of course, they don't accept at all. Now everybody is veering around, even neuroscientists, that there is a consciousness apart from mind. And in India, our ancient seers distinguished between life and consciousness. What we call life is not exactly consciousness. So we have life and consciousness as two different entities. Life is called Pranamaya, and consciousness is Vijnanamaya and Anandamaya. So it's a very interesting talk tomorrow on relation between life and consciousness. So all of you are invited. Once again, 6 o'clock tomorrow. Thank you so much, Dr. Dasgupta, for your excellent presentation, which made everybody speechless and questionless. Thank you.
Thank you.